welcome to the Wellness Project. Today we want to look at anxiety. What is it, what are the types, how does it present, and how do we manage? I know for sure that everyone has felt scared, worried, or anxious at some point in their lives about an exam, about the first proposal you're going to make towards someone. So yeah, anxiety helps us actually to free ourselves from danger through the flight or fight mechanisms, which help us to mobilize energy in order for us to run from harm or to fight back if it's something that we are faced with and we feel we can fight back. So anxiety is not entirely bad, but if it is blown out of proportion and if it's impacting on our daily life, it's impacting our relationships, our ability to show up at workplace, then it becomes erratic and problematic. So anxiety is a normal and natural response to stress and any perceived threats around us. So it's a feeling of excessive fear, worry, or unease, which will also be accompanied by some physical sensations such as a rapid heartbeat, excessive sweating, agitation, trembling, and the likes. So anxiety disorders affect up to 374 million people in the whole world, and the numbers especially rose during the pandemic, COVID-19 pandemic. This is the time when people were uncertain about everything. Was this the end of the world? Was everything coming to an end finally? So yeah, anxiety is that suffered by most people around the world, millions. So what are the types of anxiety disorders? How do they present? Stick around for this talk. Now, again, this is the right time for you to smash the subscribe button right now, to also like and comment on the video to know how you find it and how you find the content that we've been creating. I like feedback from you. So generalized anxiety disorders, these are characterized by chronic and excessive worry about very many various aspects of life. So the worry is often disproportionate to the actual circumstance. So generalized, someone has fear or anxiety about so many things. That's why it's called generalized. And panic disorder, this involves recurrent and unexpected panic attacks, which are intense periods of fear or discomfort accompanied by physical symptoms like shortness of breath. And someone will tell you that I feel intense chest pain. So if this happens, then just know that this person is probably having an anxiety disorder. So make sure that you can find a way to help them out. Social anxiety disorder, also known as social phobia, this involves fear of being negatively judged or rejected, leading to avoidance. So someone may be really scared of going out in public and meeting crowds, especially because of fear of judgment. And then we have specific phobias. These are irrational and excessive in nature. So someone could fear heights, spiders, flying, dogs, cats, I don't know. There are just very many things. So name anything and you will have that fear. So specific phobias also exist. And then anxiety, like I said, can present in a wide range of ways. And it has an emotional presentation, a cognitive presentation, and physical symptoms as well, as we are going to see as we dive into it. So someone may be restlessness, especially if it is excessive. Now, like I said, you don't pick out one symptom and label someone as having anxiety. Restlessness can occur in anything else, but it does occur in anxiety as well, as a very common presentation. So if someone has restlessness, perhaps they could be anxious. And then irritability. Like I said again, irritability can occur in other situations as well, and people may be mad for a short time, but if it lingers on and if it's affecting their life daily, then think about anxiety. Excessive worry as well, fear that is blown out of proportion to the actual stimulus, something that other people would not fear on a normal day. Fear that is blown out of proportion. You should worry about that person. They probably have anxiety. And then people having difficulty concentrating. You know, you have a racing heart, you're sweating, everything is happening so fast, people can't concentrate on anything. And then someone will have a rapid heartbeat. The heart is beating so fast because of the worry and being scared. And then sweating, activation of the parasympathetic nervous system will actually cause the person to sweat. So you could see them trembling, shaking, and having sweating as one of the presentations. So watch out for some of these things. If you're talking to someone, watch their fingers. That's why it's important to know the body language. Shortness of breath, especially in the context of a panic attack, is very, very telling. So if someone has those, you want to really connect them to help. So what are the treatment options now that we know how anxiety presents and what it is? So we have very many approaches when it comes to treating anxiety. We have psychotherapy as one of the approaches, and then other people may need medication, of course not for a lifetime, and not everyone will need medication. And then we have meditation and relaxation techniques. So psychotherapy, specifically cognitive behavior therapy, this is widely used in the world. It helps individuals to identify and modify their thoughts and patterns and behaviors, and in a way better be equipped to deal with the anxiety. And then medications like antidepressants or anxiolytics or anti-anxiety medications may be prescribed only by a specialized professional who is a psychiatrist to help you manage the symptoms, and will also monitor you as well. Lifestyle changes, very, very important. Exercise, relaxation techniques, mindfulness, these will go a long, long way, as well as eating healthy and getting enough sleep. People do not know that sleep is medicine. We are in an era where people are constantly scrolling on their phones and having less time to sleep. Please sleep enough. Support groups are very important. If you see people who are like you, going through what you're going through, or have gone through what you've gone through, it gives you hope that, you know what, I think I can also do it. And then it makes you know that you are not alone. Oftentimes people tend to think that it's just them. Then exposure therapy, slowly but surely, we get to expose you to something that you fear in graded and small doses, such that over time you get used to what you fear and you find out that you actually don't fear it anymore. So it's important to know that every person's experience is unique, and treatment is tailored according to how the person is presenting, their preferences and their needs specifically. So if you know anyone struggling with anxiety, please seek professional help. Thanks for always watching these videos. You really help us if you subscribe, if you click on the like and share buttons, if you comment on the page. You help us with the algorithm. You help yourself as well to be recommended to watch the videos that we create as we go on. So if you like the video, YouTube will recognize that you actually enjoy watching these videos. So subscribe, like, share, and comment. You will be helping us to create more content and helping us to grow as well as a channel. So thank you so much for always being here, and thank you for watching, and see you next time.